Hello everyone, and welcome to a new session of clinical pharmacology and clinical research. Today we are going to speak about Bloom's taxonomy, clinical practice question, and our topic for today will be peptic ulcer disease. We are going to cover all these 6 steps of Bloom's taxonomy, remembering, moving up to understanding, applying, analyzing, evaluating, and the final step will be creating like a treatment plan. Okay, so we'll start now. Okay, the first level of Bloom's taxonomy, we are going to speak about remembering level. Here we expect a student to recall the fact, provide definition and drug properties. The question, which of the following drugs is a proton pump inhibitor used in the treatment of peptic ulcer disease? A. Ranitidine, B. Omeprazole, C. Sucralfate, or D. Misoprostol. So the correct answer will be omeprazole. Here we talk about proton pump inhibitor and omeprazole proton pump inhibitor, PPI. Okay, this is the first level. Moving to the second level, understanding, comprehension. We need to be able to interpret, summarize, and explain the information. Why is sucralfate is not usually administered with a proton pump inhibitor? We don't recommend to prescribe sucralfate with a proton pump inhibitor here. Again, sucralfate considered like cytoprotective agent. Proton pump inhibitor reduce acid secretion. A, it enhances acid secretion. Okay, it enhances acid secretion. B, it is ineffective when acid is suppressed. C, it reduces the absorption of antibiotic. Or D, it causes CYP450 inhibition. CYP stands for cytochrome B450. This is type of metabolism pathway in the liver. So what is the correct answer here? The correct answer will be sucralfate is ineffective when acid is suppressed. So what we have here, when you add sucralfate with the BBI, this will inactivate sucralfate. Okay, if you add it also with the H2 blocker, this will lead to the inactivation. The same will be applied if you add it with the antacid. This will lead to the inactivation. Therefore, we recommend to use sucralfate away from the antacid medication, from the proton pump, from the H2 blocker, and from the antacid. Okay, moving to the third level of Bloom's taxonomy, applying, application, use knowledge in clinical scenarios. Patient is prescribed triple therapy for Helicobacter pylori, positive peptic ulcer. Which of the following combination is correct? So here we have peptic ulcer and we have a bacteria, Helicobacter pylori. So which combination we are going to use? And here we talk about a triple therapy. So we're looking for triple therapy here, and A, B, C, D, all triple therapies. Okay, start with the first one, omeprazole, clarithromycin, metronidazole. B, ranitidine, metronidazole, sucralfate. C, sucralfate, amoxicillin, clarithromycin. Or D, omeprazole, sucralfate, ranitidine. So the correct answer will be, okay, so the correct answer will be omeprazole, ranitidine, omeprazole, clarithromycin, metronidazole. This is a triple therapy here. Okay, again, for the triple therapy to eradicate Helicobacter pylori and accelerate healing of ulcer, omeprazole, PPI, and clarithromycin, metronidazole. Okay. So as you can see here, the correct answer will be omeprazole, ranitidine, and metronidazole. Moving to the next level, this is level number 3, applying application. Next level will be analysis or analyzing, break down the complex clinical cases, comparing drugs. Which of the following best explain why misoprostol contraindicated in pregnancy? Okay, so we don't recommend to use misoprostol during pregnancy. Number 1, A, decreases prostaglandin synthesis. B, increases mucus secretion. Or C, stimulate uterine contraction. Or D, inhibits gastric acid secretion. So the correct answer will be misoprostol, considered like contraindicated during pregnancy because it stimulates the uterine contraction and may cause abortion. Okay, level number 5, evaluation or evaluating, making judgment based on the criteria and prioritizing treatment. The question here, a patient with a history of NSAID-induced ulcer need ongoing NSAID therapy. Okay, the patient is already on NSAID, but this NSAID has maybe present history of ulcer in this patient. They said, which is the best pharmacologic strategy for this patient? Add H2 blocker like ranitidine, add misoprostol, use antacid as needed, or use bismuth subsalicylate. Okay, the correct answer will be add misoprostol. Here I would like to clarify important concept. For example, when you have patients from NSAID plus inducing peptic ulcer disease, misoprostol the best pharmacological strategy, but for the treatment, the best treatment strategy for this patient, the best treatment strategy with a safety profile, the safety profile will be proton pump inhibitor. Okay, following by H2 blocker, in order to avoid adverse drug reaction for maybe the patient. Okay, the last level of Bloom's taxonomy, which mean developed like a treatment plan, modifying regimen of treatment. Okay, the design a treatment plan. Here you ask about design plan for newly diagnosed patient and Helicobacter pylori negative for this patient, and this patient suffer from NSAID-induced peptic ulcer. How we can manage the situation here? So newly diagnosed patient with a peptic ulcer disease due to the NSAID therapy, but this patient present negative Helicobacter pylori. Number 1, start with the sucralfate only. B, discontinue NSAID and start omeprazole. C, continue NSAID and add ranitidine. Or D, start bismuth and metronidazole. So what is the correct answer? A, B, C, or D? So the correct answer will be discontinue NSAID and start omeprazole. Okay, here we like to maybe justify why we don't use ranitidine for this case here, or why we don't use sucralfate, for example. Sucralfate considered like protective agent, cytoprotective. Bismuth and metronidazole provide like antibacterial, and we have negative antibacterial here. It's not the option on the table here. Okay, so we only think we need to figure out why we recommend stop the medication and start with omeprazole rather than ranitidine. Okay, if you look on this table here, you can see the cimetidine. Let me make it like slideshow. Okay. Okay, as you can see here, we have I'm going to use the mouse here. ranitidine, famotidine, it's only block one pathway, and you can see here we have four main pathways that induce acid. If you use only ranitidine, we block only one pathway. However, NSAID is related to the other pathway. NSAID related to the inhibit prostaglandin synthesis. So in this case, it's not enough to block the acid. The best way to block the acid after using NSAID will be a proton pump inhibitor, as you can see it here, to block the final step of the secretion. Okay, so moving to the next. So this one will conclude the peptic ulcer disease. Our next Bloom's taxonomy will be angina. We address the Bloom's taxonomy, different level of maybe comprehensive information. Start from remembering, understanding, applying, analyzing, evaluating, and finally creating. Thank you so much for your time.